Hello friends. Welcome back. Today, I will be talking about the point-of-care tests that are a boon for the emergency physicians while dealing with their patients, and the focus would be infectious diseases. I will cover the fundamental differences between the central labs and point-of-care labs. I will also discuss the point-of-care tests that are commonly used in the emergency department and which ones are available for use in the emergency. I will also briefly touch upon the principles, limitations, challenges and the future of point-of-care tests. The central clinical lab is the backbone of lab services for any hospital. The purpose of central labs and point-of-care tests is entirely different and cannot be compared with each other. The central lab can process thousands of samples in a day, but point-of-care machines cannot do that. Central labs have highly sensitive, specific, costly and sophisticated instruments that are operated by trained persons. The central labs need time for processing, analyzing and reporting of samples. The point-of-care tests, on the other hand, have fast turnaround times, and most machines process one sample at a time. They can be performed near the patient and do not need samples to be carried to faraway labs. Point-of-care tests are performed by personnel with minimal training on easy-to-operate equipment, and most importantly, they have therapeutic relevance for the patients. They are very useful in quick decision-making in the emergency, operation theaters, labor room, outpatient departments and even inpatient departments. Here you can see the basic difference in the processes followed in central labs versus point-of-care labs. The point-of-care labs mainly act by saving time and providing crucial inputs to the emergency physicians, enabling them to make important patient decisions. This is a scenario that explains the role of point-of-care testing in the context of infectious diseases in emergency department. We give early empirical antibiotics to all sepsis patients, but there are a number of infections where the empirical antibiotics are not effective. Point-of-care tests are available for most of these infections and can prove life-saving for the patients if done in time. For any test to be called a point-of-care, as per the WHO, it must be affordable, sensitive, specific, user-friendly, rapid, equipment-free and deliverable to the end users. ASSURE is the acronym used for this. Although many point-of-care tests require equipment, but they are quite easy to handle. Point-of-care tests have several advantages for the processes in the emergency. They are life-saving by rapid and enhanced diagnostic capabilities and make the emergency more efficient by reducing the overcrowding. This is true, especially for infections. Another very important use of point-of-care tests in emergency processes is their role in infection control measures. As a frontline service, the emergency personnel and the patients are always at risk of getting infected by the infectious patients. This can become a problem when we are dealing patients with COVID, influenza, tuberculosis, plague, cholera, Ebola, chickenpox, measles and so on. Early diagnosis of these infections using point-of-care tests help us follow appropriate isolation precautions in the emergency and then in the rest of the hospital. In addition, the point-of-care tests do help in limiting the antibiotic overuse and prevent emergence of resistance. Timely diagnosis also reduces unnecessary procedures, hospitalization and proves cost-effective both for the patient and the hospitals. One major advantage of point-of-care is that they can be performed for infections using a wide variety of samples such as blood, urine, saliva, feces, nasal swabs, throat swabs and so on. Emergency departments in most hospitals are well versed with point-of-care tests like pregnancy tests, glucometers, electrolyte and blood gas analysis, urine strip testing, troponin testing, and tests for inflammatory markers. However, we need to incorporate tests for infectious diseases also into the routine emergency processes. This is a list of bacterial, viral, fungal and protozoal infections for which point-of-care tests are available and should be made available in the emergency departments. The applications of these infections are diverse, from neonates to pregnant females and to the geriatric patients. You can take your time and see where your emergency stands in terms of the availability, need and usage of the tests for these infections. Point-of-care tests for infections have found their use in various settings that can vary from home-based self-testing for HIV, testing in village-level hospitals, testing in the outpatient departments, smaller peripheral labs and finally the hospitals. The technology behind the point-of-care tests for peripheral usage is simplest, like rapid diagnostic tests and dipsticks, and it becomes somewhat sophisticated for hospital-based settings, for example TrueNOT and CB-NOT testing for various infections. The principles behind point-of-care tests can vary widely, from immunoassays, nucleic acid amplification, biosensors, microfluidics, electrochemical assays, nanotechnology, and so on. The most commonly used principles are the immunoassays that use lateral flow assays. Example of an immunochromatographic test strip is given here. The sample is added on a nitrocellulose strip on one end of the strip that flows and meets the reagents in the middle, leading to the formation of lines. The result is a visual formation of colored lines that is easy to interpret. These assays are available mostly as a strip in cassette format but can also be found as strip in tube formats. We all have extensively used these as rapid diagnostic tests for COVID-19. While selecting POCs, we need to consider the following: accuracy, turnaround time, ease of use, and cost-effectiveness. Point-of-care tests can sometimes be tricky because of the false positive or negative results. Therefore, we need to understand the basic concept behind any test, that the post-test probability will always depend on pre-test probability. Therefore, before ordering a test, one must know why it needs to be done and what are the chances of the infection in a particular patient. Also, when in doubt, it is always wise to consult guidelines and infectious disease experts. Quality control for point-of-care tests is important so that they remain relevant in clinical practice. Regular performance checks, training of staff, and external quality assessment programs should become the part of the hospital culture. These are some limitations and challenges in adoption of point-of-care tests in the emergency settings. First is the inappropriate use of the diagnostic tests. Others include insufficient training, incorrect interpretation of results, lack of quality control, failure to capture results in emergency medical records, and finally compromised local as well as national surveillance for point-of-care tests. Before the point-of-care tests are widely used, we must know the pitfalls and challenges. Their overusage and blind reliance on results should be avoided, and therefore we need to regularly train and educate emergency physicians to perform point-of-care tests accurately. Research, training and retraining is needed on the actual benefit and usage of point-of-care tests in our settings. The future of point-of-care tests is really promising with advancement of technology. Some notable examples include lab-on-a-chip technology that uses miniature devices with automation at every step, using a very small sample and without manual handling of the sample. Then we have technologies with a flexible platform that can be rapidly modified to suit novel pathogens. Other innovations include compact molecular diagnostic systems like TrueNot, smartphone-based technology, wearable technology, integration of artificial intelligence, machine learning and neural networks into point-of-care tests. To summarize, there is a need for placing diagnostic tools directly in the hands of clinicians. Need for faster availability of results for better clinical outcomes. The immediate targeted treatments with the help of point-of-care tests will prevent the emergence of resistance to antibiotics. Point-of-care tests help in detection of pathogens that are poorly detected with conventional approaches. Knowledge of point-of-care tests that relevant for a specific clinical setting is mandatory for good and effective clinical practice. Evaluation of the cost-effectiveness of point-of-care tests helps in running the systems smoothly. With it, we come to the end of this video on the point-of-care tests in the emergency departments. I hope you liked the video. Like, subscribe, comment and share, and do not forget to press the bell icon to receive the updates of all new videos. Thank you for patient listening.